Let's imagine a guy, we'll call him John. He's over 40 and he's fed up. He's sitting at his computer late at night, his face lit only by the glow of his screen. He's seen all the ads, the pop-ups, the miracle pills, the one weird trick videos. After years of misinformation and empty promises that just left his wallet lighter, he's finally done. Now he's in a sterile, clinical-looking office, sitting across from a urologist, a real expert, to get a straight answer. He wants to know the one single scientifically proven way to increase size. But the doctor's answer is going to surprise him. It's not a pill. It's not a cream. It's not even really a surgery. It's a mechanical device, and the reality of using it is incredibly demanding. What John is about to learn will change everything he thought he knew, and it's the same truth you need to hear if you've ever asked the same question. First, let's cut through the junk. So, John, the urologist begins, his tone calm and direct. You're here because you want to know what actually works. Before we get to that, we have to talk about what absolutely doesn't work, because that's where most of the danger is. This is the conversation millions of men wish they could have. The first thing a real expert does is clear away the noise. Those pills you see advertised with dramatic before and afters? They're scams. Let's be crystal clear. There is no pill or supplement approved by the FDA that can increase your penis size. It's just not biologically possible for a simple pill to build new tissue like they claim. These products are usually unregulated and can be packed with hidden, dangerous ingredients. They prey on insecurity. Best case, they do nothing. Worst case, they cause real harm. The same goes for creams and lotions. Rubbing a cream on your skin can't fundamentally change the internal structures responsible for an erection. It's a marketing fantasy designed to take your money. Then you have vacuum pumps. While a vacuum device can pull blood into the penis and make it temporarily erect, there isn't good evidence that it creates any permanent increase in length or girth. In fact, using them the wrong way can lead to bruising, damaged blood vessels, and pain. It's a temporary effect, not a permanent fix. Some very limited studies suggest you might see tiny changes with prolonged use, but the evidence is weak. The internet is a minefield of these false promises, and men, especially those over 40 who are navigating changes in their bodies, are the #1 target. These scams work because they sell an easy answer to a complicated and sensitive question. But the truth isn't simple. It's medical, it's scientific, and it requires you to hit the reset button on your expectations. Why are you really here? Size versus anxiety. Before I tell you what has some real science behind it, the urologist continues, leaning forward, we need to talk about why most men are in your shoes. It often has less to do with their actual size and a lot more to do with how they see it. This is the part of the conversation the male enhancement industry hopes you never have. They make their money from an insecurity called small penis anxiety. This is a very real psychological condition, a type of body dysmorphic disorder where a man has an obsessive worry that his penis is too small, even when it's medically normal. So what is medically normal? Decades of data have given us a clear picture. The average erect penis is about 5.1 to 5.2 inches long. A penis is only considered medically small, a condition called micropenis, if it's shorter than 2.9 inches when erect. The vast majority of men who worry about their size are well within that normal range. The problem is, our perception has been warped by porn and advertising, creating an unrealistic standard very few men can meet. Studies consistently show that while nearly half of all men wish they were larger, over 85% of their female partners say they are perfectly happy with their partner's size. The disconnect isn't physical, it's psychological. For many men, the best solution isn't a risky procedure, but talking to a therapist to address the anxiety head-on. If you appreciate this no-nonsense, evidence-based approach to men's health and you're tired of being sold lies, take a second to subscribe to this channel. We cut through the hype to bring you information from real experts that you can actually trust. Go ahead and hit that subscribe button and turn on notifications so you don't miss what's next. The scientific reveal, the method with a track record. Okay, the urologist says, turning to a diagram of penile anatomy. Now that we've cleared away the myths and talked about the psychology, let's get to the science. There is one non-surgical method that has been shown over and over in studies to produce a modest increase in length. It's not magic. It's a biological principle called mechanotransduction. The method is called penile traction therapy. Penile traction therapy is exactly what it sounds like. It involves putting the penis into a medical device that applies a steady, gentle, and very long stretch. The idea behind it is that human tissue, skin, muscle, you name it, will gradually expand and grow when it's put under sustained tension. It's the same concept used in other parts of medicine, like when surgeons stretch skin for a skin graft. The device is basically a frame with a ring at the base that goes against your body and a support at the other end that holds the head of the penis. In between, springs or rods create a pulling force. This force has to be applied consistently for a very, very long time. Among non-surgical options, this is the method with the strongest and most repeated peer-reviewed evidence for adding length. But this is where we get to the tough reality that John wasn't ready for. The devil is in the details. The catch. What it really takes. The urologist looks John right in the eye. The studies show it can work, but the ads for these devices don't tell you what it actually takes. This is not a quick fix. This is a part-time job. This is the truth that gets buried in the marketing. To get any real results from penile traction, the commitment is enormous. The research is clear. You have to wear the device for several hours every single day. The studies that showed it works had men wearing it for 4 to 6 hours a day, sometimes more. And for how long? Not a week or a month. We're talking 3 to 6 months or even longer just to see results. And what are the results? After all that time and dedication, the average gain in length is modest at best. We are talking about an average increase of about 1.5 to 2 centimeters. That's less than an inch. For some guys, the gain is less. For some, there's no gain at all. Then you have the side effects. Wearing a mechanical device on a sensitive part of your body for hours a day comes with challenges. Things like temporary numbness, bruising, discomfort, and skin irritation are common. While serious problems are rare if you use it correctly, the daily reality is one of major inconvenience and discomfort. This is the shocking truth. The most proven non-surgical way to increase size isn't a pill or a 5-minute exercise. It's a grueling, disciplined, months-long process that demands a huge chunk of your life, all for a potential gain that's measured in centimeters. The last resort. A quick word on surgery. So what about surgery? John asks, his head spinning from the reality of the traction device. Surgery exists, the urologist confirms, but it's an absolute last resort and it comes with its own serious risks. The most common surgery for length is the suspensory ligament release. A surgeon cuts the ligament connecting the penis to the pubic bone, letting more of the internal shaft hang outside the body. This can make the flaccid penis look longer, but it doesn't increase the erect length at all. And the trade-off can be huge. Cutting that ligament can make the erection less stable, causing it to be less firm or to point downwards. There's also a risk of scarring and being unhappy with how it looks. Other procedures for girth, like fat injections, are known to be unpredictable. The fat can get absorbed unevenly, leading to lumps and deformities. The pneuma implant, a silicone sleeve placed under the skin, is FDA cleared for cosmetic use, but it's a major surgery. It has significant risks of infection, the implant shifting, and patient dissatisfaction that can sometimes require another surgery to remove it. Urological associations urge extreme caution with these procedures. Conclusion: the realization and the path forward. John leans back in his chair. He's not shocked by a miracle cure. He's shocked by the stark, demanding reality of the truth. He came in looking for an easy fix and found something else. A scientific fact wrapped in a massive commitment. The frustration he felt from the online scams is gone, replaced by a clear-eyed understanding of his real options. The path forward is now clear, and it's not about chasing a fantasy. It's about accepting 3 realities. First, the online world of male enhancement is full of predatory scams that don't work. Second, for most men, the worry about size is a psychological issue, not a physical one. And third, the non-surgical method with the most proof requires a level of dedication that few men can commit to for a modest result. While medicine is always advancing, the journey for a bigger penis today often leads you right back to where you started, with yourself. The most powerful enhancement isn't mechanical or surgical, it's mental. It's about confidence, health, and understanding what really matters for a fulfilling life and relationship. Part of that overall confidence comes from knowing you're at your best. While we've been very clear that pills can't increase your size, Improving your hormonal health and performance is a different conversation. Some herbal supplements may help support testosterone levels and increase stamina. For our viewers interested in a viable solution to boost testosterone and last longer in bed, we encourage you to look into our herbal product, Ideal Solution, as part of a healthy lifestyle. If you're tired of the scams and want more honest, evidence-based information about men's health, make sure you subscribe to our channel. We are committed to giving you the facts so you can make the best decisions for your health. Click subscribe and share this video with someone who needs to hear the truth. Thanks for watching. This is Dr. Peter White. See you on the next one.